I've been a bit disappointed, I think, at the quality of the debate on health and social care. We're not facing up to the scale of the financial problems that we've got. There's a degree of magical thinking that some of the solutions that are being proposed around integration or reconfiguration will actually realise the sorts of savings that are being claimed in anything like the time that we've got available. We've got a structure that really doesn't seem to work terribly well, and indeed competing bits of that structure that don't seem to be as aligned as they might. And we're really just not facing up to the scale of the challenge, and I think that is a concern. There's still a lot we could do in terms of improved efficiency, just getting some of the basic processes right. There is opportunity to make much better use of the estate than we're currently doing, and there's certainly still residual inefficiency, but actually some much more imaginative models of care delivery are going to be required if we're going to meet the financial challenges we face. And my concern is that we don't really have the time to do that, and it's not immediately clear what those models are. And it's rather easy to say, well, we should reconfigure hospitals or we should create more integrated care. But actually, we've learned from experience that these things take quite a lot of time. Often they need experiment, and almost always they require parallel investment. So the creation of some sort of change fund, as David Nicholson has been suggesting, looks like a good idea. It's perhaps a shame that he didn't have it 5 or 6 years ago. We certainly need to join up health and social care. It's going to make a big difference to people using the services, and there are opportunities, for example, to reduce the use of residential and nursing home care for some people where staying at home would still be an option. But I think the scale of the growing demand and the fact that people are increasingly self-paying means it isn't just a matter of joining up local government services with healthcare. We've got to think about how we do wraparound services when the user themselves is paying for the service. There's great people here at the Nuffield Trust. It's already got a very well-developed agenda of interesting work in terms of analysis, of quantitative and qualitative evaluation of new models of service. My big interest has really always been about what are the people on the ground doing that's innovative, that's seeming to work, and how do we bring that back to the policymakers and make them think differently, as well as helping the people at the front line make sense of some of the things that the policymakers decide to do.